Really, what is genetic testing? The proper term is actually pharmacogenomics. Pharmacogenomics, otherwise PGX. It is the study of the science combining pharmacology and genomics. So the purpose of genetic testing, we really use it to explore how genetics may influence a response to a drug. It is part of what we call precision medicine, which is the new buzzword, but there is a new field called precision psychiatry. And this is the model that emphasizes personalized care based on your specific characteristics. Example of it is, how do you use the genome to help determine what medications you use? So why do we use pharmacogenomics? As we know, a genetic testing result will give us evidence and insight to how a patient responds to a medication. As we know, it is variable. But I want to say that even with a genetic test result, we still cannot determine the perfect drug. We still have to use our clinical judgment, as well as eliciting the symptoms, talking about what medications they've had in the past, what failed, even family history, what medications the family members have responded to. And then using genetic testing, we can then come up with a personalized treatment plan specific for their DNA. So who can benefit from genetic testing? It's kind of sad, but we tend to go to genetic testing only when we have medication failures. And unfortunately, in psychiatry, lots of failures. Treatment-resistant depression is 50%. Treatment-resistant anxiety is 50%. Treatment-resistant ADHD is 25%. Treatment-resistant bipolar, depression, 2/3. OCD, 50%. So half of the time, we are not going to find the right medicine for this patient. It takes time to figure it out. So what I've done with genetic testing, instead of resorting to it as the last resort, I have used it as first-line treatment, because that way I am not trying to experiment on a patient. I get to the point of what the problem is and use the treatment that is specific for them. So a lot of colleagues of mine, they always say genetic testing does not work. And I think the only reason why they say that is because they're not really using it the way that it needs to be used. I want to present evidence that genetic testing does work. There's a study in May 2014, American Journal of Managed Care. It's called Pharmacogenetic Guided Psychiatric Intervention, Associated Increased Adherence and Cost Savings. So how did they do this? Well, they ran insurance claims. This was actually a study done by Mauricio Fava, who is the psych clinical director of Harvard's. So they looked at claims, they compared the people who had genetic testing done versus people who didn't have genetic testing done. What did they find? They said the people that had genetic testing done were more adherent, and it also decreased costs by 9.5%. This study was an outpatient study that they reviewed these claims. So they concluded that you can use genetic testing, pharmacogenomics, in everyday psychiatric clinical practice. It doesn't have to be the last resort. Here's another study, April 2015, Journal of Primary Care Companion CNS Disorder. This one's titled Naturalistic Study of the Effectiveness of Pharmacogenetic Testing to Guide Treatment in Psychiatric Patients with Mood and Anxiety Disorders. The objective was they wanted to study the results of genetic testing in a real world setting and to assess the impact on what treatment decision the clinician will come to. What's the method? It was unblinded. What they did was they analyzed 685 patients who've had genetic testing done. And the results were pretty good. the clinical global impression improvement scale indicated 87% of the patients had measurable improvement. And they were either minimally, much, or very much improved. And out of that, 62% had significant clinical improvement. So I'd assume this is a much improved and very much improved category. So they concluded also, by reviewing these things and eliciting symptoms from a patient, symptoms improved, less side effects, and greater quality of life, which is really what a lot of patients come to me, because they've been everywhere, they've done everything, and this is the biggest complaint. They said, I'm still not better, I can't tolerate the side effects, and my life sucks. So why can't we use a tool today that can help us give these patients improved symptoms, less side effects, and greater quality of life? This is what these patients are looking for. So we have an option that we often leave on the table. Last one, I think this is the last one. This is one of the later studies, January 2018, Journal of Psychosocial Nursing and Mental Health Care. This is titled Review of Pharmacogenomics in Psychiatric Clinical Care. And they came up with this, that in this review, they found evidence that using genetic testing for psychiatric illness shows improved patient outcome, as well as, again, decreasing healthcare costs. So, does genetic testing work? Yes. Unfortunately, a lot of our clinicians are not using it the way that I do. And with the way I use it, the focus is on pharmacodynamics versus pharmacokinetics, because you have to consider both in order to really get the proper treatment plan. And still, we talked about, you have to use your clinical decision to come up with the best plan based on the patient's profile, as well as their genetic testing and their experience.